Good afternoon. My name is Joan Reed. I'm Dean for Diversity and Community Partnership at Harvard Medical School, and I want to welcome you to today's program, Applying to Residency in the COVID-19 Era. The mission of our Office for Diversity, Inclusion, and Community Partnership is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, ensure equity in health locally, nationally, and globally. Today's program, Applying to Residency in the COVID-19 Era, is part of a DICP, Diversity, Inclusion, Community Partnership Visiting Clerkship Program. This Visiting Clerkship Program was started more than 20 years ago. It's had more than 1,500 students who have participated since it started. Like most U.S. medical schools, our Visiting Clerkship Program has been drastically impacted by COVID-19. We also recognize that there is much uncertainty about what the upcoming application cycle for residency will look like. Students have expressed concern about the kinds of possibilities the future may hold, and with this in mind, we'll be hosting a series of webinars that bring members of our residency programs, our faculty and residency community, and medical students together to share ideas, provide support, and address questions on moving forward, including thinking about our next stages in medical training, addressing questions about away rotations, the application process, and other concerns. More than 1,700 individuals have registered for today's program, the first in our series, this program on applying to residency in the COVID-19 era. I now have the pleasure of introducing the moderator for today, Dr. Alden Landry, who is an emergency medicine physician at Beth Israel Deaconess Medical Center here in Boston, and the assistant dean in our Office for Diversity, Inclusion, and Community Partnership. Dr. Landry?
Here joining us for this presentation. We are excited to be here to have this discussion when it comes to the application process for this upcoming application season for residency. We know that there's a lot of stress and anxiety that is coming from students, but also from programs during this time. And so we wanted to create a space that we can get together, have some candid and honest conversations around what students should be doing to better prepare themselves for the residency application cycle, and also what program directors may be thinking during this space. And we want to make sure that we use this time to try and answer as many questions as possible. As many of you know, when you submitted your registration to this meeting, we took in some questions from students, and we tried to distill that down into the most salient points and common themes coming from students, and to use that as a space to have this conversation over the course of this hour. And so with that, I want to know that all of the information that we're going to be delivering today is based off of the thoughts and opinions of those affiliated with our program, and not necessarily coming from ERAS, the AAMC, or the NRMP. Next slide. As Dr. Reed mentioned, unfortunately, the COVID-19 pandemic has impacted our ongoing program, the Visiting Clerkship Program. As with past years, we were excited to host students who were going to come and participate in away rotations on our campus. Unfortunately, HMS has decided to suspend all visiting clerkships indefinitely. Because of this, we wanted to make sure that we created programs that are going to be able to support students that would have typically been on campus, rotating with us, visiting our hospitals, and meeting our residents, faculty, program directors, and so on. And so with that, we created this series, which today will be the kickoff event that we do. But please know that as soon as we have the opportunity to start hosting students, we will do our best to make sure that we open our doors and accept students to come and do rotations with us as soon as it is deemed safe, and as soon as Harvard Medical School feels that they have the appropriate infrastructure in place to start supporting students again. Next slide. So just a couple housekeeping notes and disclaimers. As I mentioned already, these are views and thoughts and expressions that are coming from HMS, in particular those individuals who are participating on this webinar as panelists. However, please defer to the AAMC and the NRMP for future information about delays, should there be any, and any schedule adjustments that may happen when it comes to the application process. All of your lines are muted, and so the only people that you will hear speaking will be our speakers. If you have questions, you can feel free to ask during as a part of our Q&A tab, and I will try and go through and filter out questions to make sure we address other concerns that may not be come up in our first round of questioning. And then lastly, the webinar is going to be recorded and it will be posted on our DICP website in the near future, so that should you have questions, you can refer back to our website for more information. Next slide. So I want to introduce our speakers for today. We have an amazing group of individuals coming from various backgrounds and various vantage points in the application process for residency. So first I want to introduce Dr. Adaira Landry. She's the Assistant Program Director at the Harvard-affiliated Emergency Medicine Residency, which is co-located at both Brigham and Women's Hospital as well as Massachusetts General Hospital. She's an assistant professor at Harvard Medical School, and she's the Ultrasound Fellowship Director. Secondly, I want to introduce Dr. Rachel Stark. Dr. Stark is the Director for the Residency Program in Internal Medicine at Cambridge Health Alliance, and she's also an instructor of medicine at Harvard Medical School. And last but not least, I'd like to introduce Dr. Carrie Tibbles, who is the Director of Graduate Medical Education and the Designated Institutional Officer at Beth Israel Deaconess Medical Center. And so with that, with these three amazing physicians and medical educators, I wanted to make sure that we opened up with some themes and some questions. And we're going to try and go in order as the direction of students may be thinking about the application process from a chronological standpoint, and then move on to answering some general questions that students may be asking. And so first I want to go to you, Dr. Stark. Speaking from a program director's perspective, what are your overall thoughts on how this application season will be different than years prior?
Thank you so much, Alden. I think this application cycle is going to be different for students and programs alike. And I think it's really important to highlight that. So certainly just as the students are going to be concerned about this, program directors are going to be able to acknowledge the fact that as students apply in this cycle, there are going to be things that are going to be different in terms of delay of exams or exam scores that might have been ready for the application cycle. Grades in clerkships may be delayed, as we're aware that for the last several weeks, many medical students have not been able to participate in clerkships, and certainly over the coming months, there's going to be some instability in that in lots of places. And similarly, just as the visiting clerkship through HMS has been suspended, we understand that students who otherwise may have done electives at our institution or other institutions are not going to be able to do that this year. And so as a result of that, program directors are going to have to review applications with that lens. And I think it's important for the students to understand that, we know that you have concerns about all of this, but we also recognize that none of this is your fault. And we're going to have to sort of be limber and respond in kind to sort of what is the situation presently. And additionally, that, to sort of, as we get towards interview season, the other thing that many of us are thinking about right now and what may come to pass is that interview season may be held in some sort of virtual way, or a combination of virtual interviews and in-person interviews. So all of us are pivoting at the moment in anticipation of this residency cycle being a little different, and recognizing that students should not be penalized for that.
Yeah, thank you for sharing that, Rachel. I think it's really important for us to understand that just as much as students are feeling angst and uncertainty, program directors are as well. And I would like to say that I don't think there's anybody who's advantaged or disadvantaged. I think we're all equally affected by this. And because of that, we're all in this together. And I think that's the take-home point that I would definitely like students to to hear as we have this discussion going forward. Dr. Tibbles, a similar question. You're as a designated institutional official at BIDMC. What are you hearing from program directors as they feel, as they deal with the uncertainty in this application cycle?
Thank you, Alden. And I think it's really funny. I think the program directors have the same sort of uncertainties we've been talking about that the students do, almost in they want to make sure that they can still figure out how to put their best foot forward, and that they can show students, this is what's great about our program, this is what it's like. When somebody's there for a month, you get lots of interaction and connection. And in the end, a big piece of how you're going to choose your residency is where you feel connected. Did I feel like I fit there? Do I feel connected? Do I relate to the faculty who will be teaching me? Do I want to become where I see the types of grads that they put out? Do I enjoy the city? And so much of that happens organically when you're with us, that what we're going to need to do instead is figure out how to help you learn as much about us as we can. Figure out ways. So we're starting already I'm starting to film a virtual tour of the hospital. I'm starting to do some interviews that can be online so you can meet residents. And then we're going to talk a little more, and I'll talk about some more specifics we're doing. But I think in the end, just like students want to get to know programs, you think that we're evaluating you to come. I think the biggest thing is you're evaluating us when you come and interview. And so we're trying to figure out, how do we show our distinctive sides? How do we show how unique we are? How do we show the way we take care of residents and what we're about, and figuring out how do we portray that potentially in some different ways?
I think that's really important, Carrie, because oftentimes when we are in these spaces and we think about what your feeling is when you walk into the door of a hospital and you start to meet the residents and interact with the faculty, that can really change the way that you perceive a program, regardless of what you see on paper. And so I think it is important that residencies are wanting to put their best foot forward and trying to think about how they can engage students as best as possible. Again, knowing that there's going to be that level of distancing that we're not going to be able to overcome potentially if we don't have a typical interview season. So Dr. Landry, a question for you. I've known and worked with you for a while now, and you mentor a number of students. Can you just talk about some of the concerns that you're hearing from the students that you work with? And I think what you may offer is something that will resonate with a lot of the students who decided to join us for this webinar today.
Yeah, thanks. And thanks for inviting me. One of the unique things that I'm able to do is sort of see both sides. As an APD, I can see what's already been mentioned on the residency leadership side, the hospital leadership side, as far as the stressors for making sure our students feel supported. But then I also can see from my HMS position how much anxiety and stress students are sort of having around this upcoming process. And a lot of it sort of circles around this theme of, have I been disadvantaged because of COVID? Or am I okay? Am I going to be okay? And in many ways, students have sort of broken down these questions of if I'm disadvantaged or if I'm okay under different categories of where the application process might unfold. So it could be from just the beginning of, how do I decide which specialty is correct for me? I was planning on using March and April to do more elective times to help decide, or speak with more mentors. Now I'm not able to do that as easily. How will I know that emergency medicine is correct for me, or that I should go into orthopedics? And so that absence of in-person time with patients, with mentors, those deep dives can make people a little bit more apprehensive as far as their ultimate choice. People are also nervous about the timelines. When will ARIS open? How will interviews be scheduled? If aways are being pushed back, can I do my aways while I'm doing an interview? Like, how will I schedule those too? So I think the combination of being unable to pick a specialty easily and then not knowing about the timeline has really created, probably to me, the two biggest types of complaints or concerns from students. And then it goes just back to like some of the basic things that have already been mentioned about home versus away electives, and if those are going to be possible just in general. And if COVID continues throughout the end of this calendar year, will students be able to go back to the bedside in their own home institutions? And the absence of that in-person encounter with faculty will lead people to have some uncertainty about getting letters of rec. Most of the letters of rec from the clinical standpoint are done based off of seeing patients together, having conversations after shifts, all sort of surrounding the clinical experience. And so the absence of having a rotation or that in-depth connection with faculty members has caused people to have some concern. And one question I'm getting quite often is, how do I improve my CV or my resume while I'm at home, you know, outside of my home institution? They might be back with their parents. I'm sort of out of that academic scene. How do I engage with opportunities? How do I enhance my chances while I'm sort of sitting at home in this unusual environment? Probably the last category is about the personal statement and what I should talk about on the personal statement. Should I refer to COVID and the COVID experiences and how that has impacted my outlook on medicine and how I'm going to fit my career within medicine? Or should I sort of talk about what I was planning on writing about earlier? So all of these broad categories sort of fall under this concern of, have I been disadvantaged, or actually will I be okay? And one thing that I try to encourage my students to think about is, it's not really like an I, my, me perspective. It's really we, our, ours, because all of us are in this situation together. This is a together experience. Stress is heightened for all of us. So from a mentorship standpoint, really reassuring students that this is a shared experience and that we're all going through this together, and no one's really going to be singled out and isolated as far as being disadvantaged is really, really important.
Yeah. And thank you for that, Adaira, because that's actually a really good snapshot of what we're going to be talking about over the course of this next 40 minutes or so, as we have this opportunity to have this conversation. Just for clarification to everyone who's participating, Harvard Medical School has suspended its away rotations or its visiting clerkship programs, so that if you were interested in applying or rotating with us, as of today, we do not know if students will be able to rotate with us during this application season. The moment we find out, we will post that on our website. We will share with our networks, and we will notify the students who had applied for the later months to come and rotate with us. But as it stands, there are no current visiting clerkship rotations available. So with that being the sort of ground that we're standing on, many students were thinking about away rotations, especially for those who are considering our specialty, emergency medicine. So what should students be doing or thinking about instead of away rotations, on how they can get to know programs or how they can introduce themselves to programs? And I want to ask that to you, Adaira.
Okay. Yeah, this is such a tricky situation because the aways are really the deepest dive you can take into getting to know a program. You have one-on-one contact with many people throughout the experience, such as patients, the administrative staff, the faculty, resident. It's just a really enhanced exposure compared to a traditional interview where you might be there for just one day. So I recognize that loss, and there are ways to sort of supplement that. I don't think anything will be a direct translation, but I think there are some ways to sort of work around that, to really trying to understand what is the program that you're considering, what is their mission, who are they, what do they represent, what do they advocate for, all those things. So just in general, I would say with all the advice we're giving, grace and moderation are key. So when we tell you that there's something that you can do, just keeping in mind moderation and not feeling like you have to put so much pressure on yourself to do all of these things, and being compassionate to yourself during this very, very stressful time is incredibly important. So these are just ideas. You don't have to feel pressured to do all of them. I would say the first thing is just to really get a good understanding of the residency and or department website that is listed online. We are, I know our personal residency, we are hoping to sort of beef ours up as well. It's been discussed sort of loosely, but that gives you a sort of an understanding of who are the residency leaders, what are the residents involved in as far as their active projects, what does the curriculum look like. It can give you some understanding of the faculty members. And from there, you can sort of see this layout, and I really believe that the people in the program, that's the main currency that's going to give you your outlet to mentorship and sponsorship and collaboration and scholarly work. So really understanding who are the people at a particular program will be very important as far as the steps to really understanding if this is a great fit for you. You can also look outside of just the medical websites and looking at public health school. Like if you're going to do public health research or you were interested in that, looking at the layout from that standpoint, and health policy, if there's a website that's online that's related to that institution, just understanding who are the people, who are the thought leaders related to that program just might help you understand who's there, who's influential. So really understanding, I think the website is a great first step. Mentors at your home school are helpful when it comes to making introductions at that program that you might be interested in. Like, I don't think you need to do this for every single program on your wish list, but maybe your top programs, and reaching out to your mentors and seeing if they know anyone at that particular program, and they might be able to set up an introduction via email or Zoom. So just so that you can meet someone and have a point of contact, even if that person might not be, that mentor might not know someone very, very, very deeply, they can still just start the conversation and you can take over from there. I do think cold emails are okay. So like I said, when you're looking through a program's website and there's someone doing research on a project that you're interested in, you can reach out to that person directly. It just is nice to have an introduction, but it's not critical. So I think finding a point of contact at a particular program, especially if it's related to a field of interest that you have, will be very important. One thing that's been sort of toyed around a bit is joining resident conference. Since everyone's having virtual conferences right now, and would it be possible for you as a potential applicant to join in? I know for sure our program has not had medical students or potential medical students joining in on our Zoom conference. I think it'll be something that in the coming weeks we'll have to discuss at some point as far as how we are going to advertise ourselves, and the fact that we really value education and we give our residents a space where they can contribute to education as well. But joining residency conference, the journal clubs, all those things that are very academic will be helpful for you to understand how our didactics run, how our residents feeling engaged in these, our faculty present. It'll be a nice exposure that you might have gotten while you were on the block. I would say those sorts of virtual exposures are great, but then also if there's anything social that is ongoing that medical students are invited to, so if someone reaches out to you and welcomes you, then I think that's great, but you want to be mindful of how you interact on a social level as well, since you are still, in many ways auditioning or trying to present yourself in a professional manner, to always maintain that sense of professionalism as well.
Perfect. Thank
The
you.
last thing that, I've been sort of advising medical students is to still consider research and scholarly activity, and how you might be able to collaborate with someone at a program that you're interested in. So again, if you meet someone or someone introduces you to a person who is, maybe an educator or does disaster medicine research or something that is aligned with yours, you can always ask, is there a way for me to get involved in your project? I'm happy to help write a case report or do some data entry, in anything that might sort of engage you into that relationship just a little bit deeper, will probably help your chances of getting to know the program very well. I think from a clinical standpoint and patient care standpoint, it's going to be tough to see how the clinical environment is set up, given that I know for sure in our emergency department, we don't even have medical students rotating. So I would sort of lower the expectation for right now that you're going to have a deep dive far and away from the clinical standpoint. But I think you can try to get to know the landscape and the periphery through the faculty and education and research point of view from home.
Wonderful, and thank you for that answer, Adaira. So the next question, again, a similar question to you, Carrie, is as we're in the situation where students are not going to have away rotations, but they want to put together the best application through the ERAS process, what can students do to make sure that as they build their application, when the process opens up, that students are able to put forward the best application possible?
No, it's a great question, Alden. So when I think about it, across 20 years of, interviewing applicants and across now all of the specialties at my hospital, I think it comes down to a couple fundamental things. I think first You want to know from an applicant that they know and understand the specialty they're going into and they have a good feel for it. And then I think number two, are they excited, enthusiastic, and very committed to being the best doctor they can be? And so when I think right now, we can't do some of the normal things, but are there some things you can do that are either going to help you learn more about your field, participate in some way that's helping you decide and make sure on that decision? So I think that's fundamental. You want to have that. But then two, is there something I can do and work on right now to help me be a better doctor? You know, and that I feel that could help me work on some different skills, sort of like me now that I'm home in COVID and I'm trying to learn how to bake bread. Like, why not, right? I've got time. And I think there are some elements of medicine we've all been so busy, maybe you don't have as much time for. And there might be things that come out of this season that you're going to be able to talk to on an interview, that by having the luxury of time, you actually really thought about and actually decided to gain some experience in, and medical Spanish, maybe it is, or something that you knew was going to help you take better care of patients. And I think those things will help your application shine. Sort of, this is where I was at, what I was doing. I felt really good about this field. So here were some things I did, even though I couldn't do some things I was hoping to really redeem the time and help myself get ready. And I think those are the two lenses I would think about. To kind of improve your application. It gives you a good time also to think about your personal statement and what's going to shine there about who you are, why you're picking the fields you're picking. And I think just to give some context, I want to give some encouraging numbers. You know, when we look at 94% of US senior med students, they end up in one of their top 4 choices of their program. And, you know, as you can imagine, when somebody's switching fields because they picked the wrong one, they come through my office, and it almost never happens. You know, it happens some, there certainly is some, but when I look across my 700 residents, it's 1 or 2 a year, maybe. So the likelihood that you're going to end up somewhere that you want to be, and that you're going to be in a field that's well suited for you and that's going to make you happy is really, really high. And I just want to encourage people with those numbers.
Thank you, Carrie. And going to you, Rachel. So a lot of students use OA rotations to express interest in a program. There are some students who are applying to residencies that their home institution doesn't have a rotation in, or they don't have access to as far as mentorship. So what are ways that students can express interest in a program without doing a rotation? And are there other ways that students can engage a program or its residents without actually being in the hospital?
Yeah, sure, absolutely. So, again, I just want to sort of reassure in the same theme as the other speakers here that the programs understand the situation, right? And as important as it is for each of you to be applying to and matching with a program that's going to support you as a learner and help in your professional development and get you where you want to be in your career, it's just as important that the programs are invested in meeting and matching students who are going to further their program and the environment of their program. So, so we are just as interested in meeting you as you are in meeting us. And I just want to continue to reiterate that point. Excuse me, understanding that we're in special times and not being able to do that necessarily in person. One thing that I always think about when students write to me with interest in our program is, what made you interested in my program? So I think it goes back to comments from the other speakers about making sure that if you're contacting us because with something that's sort of a hook that demonstrates fit and demonstrates interest and demonstrates possibly connection or network with a student, a resident, a faculty member, someone already at our institution. It's okay to email us. It's okay to use those networks. But when you do, it should be in some way sort of personalized to the program and and also really to you. So if you're interested in the mission of the institution, if you're interested in a research project, there's a lot that actually we can all be creative about in a social distancing way around research and advocacy, and connecting with folks at each one of our institutions who are doing work beyond the clinical work, because all of us are doing that, and sort of starting off with looking at our websites, connecting, through networks that you have that are personal and professional, and like you heard before, other faculty members at your school who know about people in different pockets of residency programs doing certain work, and demonstrating interest and connection by reaching out around those things. And we know that there are ways to sort of engage in work beyond the clinical work. And I also want to reassure you that most programs are really looking at applications really holistically. And I think given the challenges of the pandemic this year, even more so than we have in the past.
Great, thank you for that, Rachel. So I want to use another question, I was scrolling through the questions that were being asked by the participants. So thank you for continuing to offer us questions. And again, we're going to try and address as many questions as possible. But this seems to be a question that a number of students are concerned about, is with limited exposure to their clinical rotations, or unfortunately a student may have had a poor performance on a core clerkship, or they didn't do as strongly as they would have hoped to on step one. What can students do to help overcome those perceived deficiencies in their application? And that's for you, Carrie.
Thank you. I think what's important to remember too as a student is Rachel just said something really important, which is a holistic review. And that often when I'm sitting and I'm maybe mentoring or I'm counseling a student who's concerned about their application, the deficiencies in their application seem bigger to them than they do to me as I'm sitting there. And I want to say that first. As I'm sitting there, I hear often a different story, and I'm able to kind of help them pull out and say, yeah, but look what you did here and there. And so just even reminding you that it's a huge accomplishment to get into med school. And also on your application are probably lots of places we could talk about the strengths that you have. And so what I like to see if someone had a poor clerkship and I'm talking to them, we go through it, is often when I'm finding is, do they have some insight into why? Did they have some insight into what happened? And what did they learn from that they applied differently and they grew? Because nobody expects you to be perfect coming in. And you're definitely not perfect when you start internships. So med school is a learning process. So if you can kind of say, I did struggle my very first clerkship. I was in, pediatrics, and I really struggled, whatever it was. But what I learned was this, and I applied it. And then you can see that the clerkships are better. That's a good way to kind of talk about it. And it may even become part of your personal statement potentially. I'm not saying it definitely would, but it's possible and it could. I think the same on the STEP exam, as long as you took it again and you passed, and then you are able to show, but this is what I'm doing to help myself continue to learn and stay up with medical knowledge as I'm applying it now to patients. We all come into med school with different sets of skills around either medical knowledge versus our ability to apply that knowledge as we care for patients. So I think being able to talk about it, how you worked at it, what you've learned, and how you grew is important. I also think choosing your letter writers carefully, somebody who knows you well and who can talk about your strengths in a meaningful, authentic way, is going to be really important to highlight who you are beyond any number or letter grade that you may have gotten. So I think those are sort of my big advice for somebody who's a little bit worried about a mark that doesn't look as strong as they'd like it to.
And I just want to say two things. One, we're going to talk a little bit more about letters of recommendation in a minute. But I just want to highlight what Carrie was just saying there, in that having a person who knows you well to write a strong letter for you can really help to overcome any deficiencies in your application, and they can potentially better explain those deficiencies and save you time and space so that you don't have to include that in your personal statement, and you can use other commentary in your personal statement. So I think it's really important as you go through this process and you think about who could be potential letter writers, that you choose the right individuals, but then also provide them with the information and material, including your CV, a copy of your personal statement, and other items, so that they can help really shape and structure a strong letter for you. And so I want to switch back to you, Rachel, because this is a question that I've seen it a number of times. I've seen the discussions about it on the internet and social media. And there's this big concern about students having the ability to take their next test, specifically step 2, clinical skills or clinical knowledge. And so what should students be thinking about if they haven't taken step 2 prior to applying? Should that impact their decision on applying, the timing, and so on? So any thoughts that you may have about what's going on with step 2 and what students should do in relation to their application?
I think, again, it comes back to the same theme that we've spoken to throughout this webinar, which is the programs are going to absolutely understand that the delays for these examinations are not under the control of the students. And so I do not think that, an otherwise strong applicant should in any way decide to defer their application or delay their application because they're worried about the step 2 exam. My guess is there's going to be a lot that changes throughout this application cycle. Usually we do want people to have their step 2 grades at least on hand, not necessarily to be considered for interview, but certainly at the close of interview season or before the rank list deadline. That's sort of in standard times. And we're just going to have to see how things play out over the next many months about what is possible, recognizing that our standard deadlines are we're all going to just need to be flexible. And so I really don't want students to feel like they should not be applying for residency because they're worried about delays in step 2. We understand.
Thank you for that. Going to you, Adaira. So there's a lot of questions about what should go into the personal statement. We just alluded to possibly opportunities to talk about weaknesses in the application or poor performance on step 1. But I would love to hear your thoughts on what students should be considering as they're crafting their personal statement, which is such an important part of the application. And then I think it's also important for us to talk about whether or not students should be including a conversation around COVID, because it's so universal and because everybody's going to be impacted. Will adding commentary in that space be helpful or harmful to an application?
Yeah, so I would say my general rule for personal statements is that it should obviously be something very honest, simple, in the sense that the writing is very clear. I understand what you're trying to convey. There are no metaphors for what you're trying to say and I have to figure it out, but it's just direct writing that really reveals something that is distinct to you. So I would want your personal statement to be so clear that it's coming from you and not another applicant. So that means, generally speaking, what was the reason, what were the things in your life, the perspectives in your life or the experiences that made you decide on this particular field? What shaped you to want to become a dermatologist or pathologist? What happened? Or what is it that you want to do with this training that will help the future of medicine? Something that is pretty specific to you will be like the first opening step for this. I think sometimes it's a missed opportunity when people just use that one sheet of paper to describe what the field is. So very often for the last, I guess, 3 years or 4 years or so of reading personal statements, I'll read something and it's just a description of what emergency medicine is. You know, I like being in a fast-paced environment. I like seeing patients and then going from one room to the next. To me, it's just a description of what I do, and anyone could have that thought. Most people who are going into my fields have that thought. So it's not very specific to any individual applicant. I think because of everything with COVID and because we are going to be, I think, looking even more deeply into the personal statement, since we're not going to have as many opportunities to meet applicants via a Waze, for instance. or we might even have in-person interviews. I don't know. No one really knows. Everything is going to be just, I think, a little bit more meaningful. And so the personal statement is really going to be an opportunity to show me that you are distinct from another applicant. So I really would take that seriously. In regards to COVID, if COVID hadn't happened, everyone would still have to be writing a personal statement. So there would still be something meaningful to you that would have hopefully have driven you into emergency medicine. If you feel like that specific patient or family experience or cultural background, whatever it was, if you felt like that is still very heavy and still more meaningful to you, then I would say stick to that. If something happened with COVID to you that changed your perspective in such a way that is so enlightening and gives so much insight and so much maturity as far as who you are and what has happened to you in these last 3 months, then I would say go for that. But I wouldn't want you to do it just out of obligation because everyone in your class has done something meaningful. If you can imagine, if everyone's writing about COVID, then I'm just going to be reading COVID letters all day, which is fine if they're meaningful and distinct. But I wouldn't mind a break from that, especially if it reveals something that is unusual. You still have 3.5 years of medical school before COVID happened. Revealing something from that is totally acceptable.
Great, thank you. And so I really want to cycle back and harp in on the discussion because I think it's really important. A lot of students learn about programs through away rotations, and unfortunately, there are students that are now going to be looking for information about programs on places on the internet, social media, word of mouth, which may or may not get to the true heart of a program. And so, Carrie, just quickly again, can you tell me just a couple more recommendations on what students can be doing to make sure that they're doing their research about a program and getting to know if the program is potentially going to be a good fit for them, so that we don't see students over applying to large quantities of programs because they just don't know.
Right. No, and I think that's a great point. And I'd love to touch on that over applying piece first and then how people think about it and sort of way I would think about it. I think at first you want to be pretty broad in looking at, because that's one of the things about the fact you're doing it all virtually and such. Read about lots of programs at first, just so you can even think of great questions to ask. One of the questions I love to ask applicants and saying, okay, you're down through this interview process. Are you finding programs more alike each other or different? Just do that first, because you get a sense of like, oh, I wouldn't have even thought to ask about that, or I wouldn't have thought to ask about that. You're going to get a sense of wellness strategies. You're going to get a sense of, how they think about progressive learning. What do I do as an intern versus what am I doing as a senior resident? You're going to get all sorts of things about the philosophy and the culture. So get a broad sense, not because you're looking for a needle in a haystack, but because you want to educate yourself about the field and possibilities. Do that first. But then spend a fair amount of time being reflective and saying, what cities do I really want to live in? Because I'll tell you right now, how we're feeling as program directors is because there's been an inflation over the last 3 years of the number of applicants. What shines is somebody who has a true, authentic reason to want to live in our part of the country and has a true, authentic reason that they've bothered to really get to know our hospital. And I can tell that by what they've done on the website, what they know about the website and who they've connected to. And so I think, and sort of the other things that they know about themselves. So I think those are kind of the big key things that they really need to do. At the same time, in terms of what you're finding on the internet, there are tons of things like Student.net, Doximity, lots of sites that that talk about programs. I would look for as many sites as you want, but I'd be careful to pick your gurus. And be careful as you're seeing things. If it just doesn't line up with what other things you've known, I would filter that information to be careful about that.
Thank you. I think that's really important, as the source of information matters. So Adaira, you mentioned this earlier about ways that programs may be opening their doors to students to participate in some of their opportunities like journal clubs and resident lectures. But what should students be doing to reach out to programs? Should they be asking to speak to current residents? Should they be asking to have web conferences with program directors? What should they be doing to engage those programs that they may be interested in?
Yeah, and I imagine over the next few weeks or so, things will start to materialize, hopefully in a formal way, so that it won't be just on students to have to seek this out, because I think that can overwhelm the system from different angles if students are having to arrange Zoom calls with residents from multiple different programs. So hopefully that will actually come from the program itself down towards the students. But I think in the meantime, if you have a point person, or if there was a particular program you're heavily interested in, reaching out to, there's usually a residency coordinator listed on most program websites that you could reach out to and just ask if they can connect you with a chief resident or one of the residents who might be interested in speaking with a potential applicant. I think that's a benign request. I probably wouldn't do that for every single program, because you, again, might just get overburdened with having to follow up on all of those requests. But doing that, I think, in moderation. I think residents are great. They are a great source of information. They're basically a near-peer mentorship group for applicants. They're very familiar with the process, and they can give you a lot of input as far as what is the reality of that residency. And most residents are pretty forthcoming with the good and the bad, because they want you to have an informed decision. But keep in mind that you want to make sure you still keep that level of professionalism high, in the sense that they still have the opportunity to come back to residency leadership and give us insight as far as what the interaction was between a medical student. We still value the resident's opinion on these sorts of things. They usually only really contribute or change the path of an application, for instance, on the extremes, by saying someone was amazing, incredibly amazing and inspirational. That's helpful information for us. Or this person was actually rude or disrespectful to a patient, or said something that was quite offensive. That's also helpful for us. So just be mindful of always maintaining that moderation, that sense of professionalism as you interact with really anybody, but especially residents too.
Thank you for that. I think it's really important that we think about our social media interactions as well as our email interactions with individuals, because that does go a long way if you do something that is received poorly by a program or a person affiliated with the program that you're interested in. So thank you for sharing that. So I want to talk about the interview process, and I am seeing in the questions just a number of people who have concerned about interview timing. Will interviews be offered virtually? Will programs offer more interviews because of the complexities that go along with this application process? And so I wanted to turn to you, Rachel. What are you thinking, and how are you preparing yourself for the interview process? And then also, should students start to prepare for virtual interviews as a part of their ERAS application?
Yeah, so it's hard to know, right? I think it is probable that interview season will have at least some component that is virtual, and in some ways that's actually very good for students, right? There may be some disadvantages for the programs, because we'll want you to see us in action and see what the hospital is like, and be able to get that sort of gut feeling that you get from lunching with residents, or coming for a dinner, or spending time in our city. And we can't quite capture that when we're running virtual interviews. And I think, but we're going to have to go with the sign of the times, and we're going to have to sort of be flexible. In many ways, I think virtual interviews will be great for students to the extent that people who are hindered by cost of travel and accommodation and clinical clerkships and other responsibilities, which made interviewing in the pre-COVID era complicated. And we, as program directors, acknowledge that. There actually might be some advantages and a lot of opportunities for students and programs to be meeting each other in ways that we might not have met each other prior to COVID. So I would guess that it's really unclear what the fall will bring in terms of the pandemic, but I think all of us at this moment in time are preparing ourselves for some aspect of a virtual interview season. your question about whether that means we're going to be interviewing more people per program, I think is it's an interesting one that I don't exactly have an answer to. My instinct tells me perhaps it's around the same amount of students that we would interview in a usual season. But I think all of us as programs are going to have to look very hard at that and sort of also reassess where we are in the fall and the impact of other timelines on the interview season. And then in terms of the piece of preparation, right? So I think all interviews, whether they're in person or whether they're in this new virtual environment, students really give it their best shot if they are practicing. And practice means sitting with a trusted mentor, another student, a resident, somebody who's ahead of you in this process, and practicing the questions, practicing your comportment, practicing your answers. But really, it's one way to distinguish yourself in the interview to, as other panelists have said, to really like know the program that you are visiting or that you are interviewing at. And there are certain things that you won't know until you come and visit that place or have a virtual experience that's specific to that place on an interview day. But there are lots of ways in which our programs can be distinguished just by sort of reading online and being able to make that application to a program because the fit seems like it might be good on many different levels, and then be able to speak to that on the interview day in a way that is authentic and is engaged, and to also be able to sit with a program director or a resident or another faculty member and ask questions and engage in a dialogue that is authentic and brings your real self to that experience.
Thank you, Rachel. And Carrie, can you talk about communicating with residencies, just basically at all different phases, before the application, but then also after the application when a student may have gotten waitlisted or they don't get offered an interview? Can you talk about the best approaches to having those forms of communication, what students should do or shouldn't do in this situation?
Sure, no, great. I think it's a really important question. I think what we've been saying all along, and I'll just reiterate, is we're moving into a new phase for this pre-application period. And you should feel comfortable, reaching out and speaking and looking for opportunity to engage. At the same time, those reach outs should have some just grace in them and a little bit of awareness that these particular groups, depending on where you are in the country and what's going on, they may be knee deep in COVID response or knee deep in orienting, trying to graduate residents. There's a lot going on. So what I'd be careful about is don't take, if it takes a program director, takes somebody a week to get back to you, just let that go and know that's the timing. So I would say reach out a lot, but also be very considerate, knowing that right now is a bit of a crazy time for everybody as we're trying to figure all this out and take care of patients that are in front of us for various reasons all across the country. I think the other interesting question you asked me, and I spent some time that I've spent some time over the years thinking about this, is that if you don't get an interview or maybe you get waitlisted, there is an element that it's a numbers game, and you could be very, very just as qualified as many of the other people on their list, but at some point there was just a simple cutoff. I think what Rachel's saying is true. We just went through fellowship interviews virtually. Some of the surgical specialties actually match right now. And so we had some experience with virtual. It worked, but we didn't necessarily increase the total number of people we were interviewing, I think, and I don't suspect that necessarily will happen, although I suppose there is some possibilities. If you get waitlisted or you don't get an interview, and it's the place you think you'd really enjoy, go ahead and send an email to the program director, but in that email, be very specific about why you're specifically interested in their program. And then really make it worth their time to read and understand this is why you're interested. And you very well may get an interview. You may not if they simply don't have it, but if you also can get on a list, there tends to be an interview season about a 10%, sometimes higher attrition rate As people go along in the end of the season, some new slots open up, and you could potentially get on a list to get an interview later, even if they don't have a spot right then. That being said, and I think this is my most important advice on that, I have wonderful colleagues all over the country, as I know the other DIOs across the country, and they do an amazing job taking care of their residents. And as I sit, I was even on a call yesterday with all the DIOs in Boston where I sit, and they all love their residents. They're doing amazing things. I would recommend, just like your best friend might say, if you just broke up with somebody, they might say, okay, might be time to move on. Maybe you loved that program, but I'd love for you to just start thinking about where else might I be really happy? And maybe I could invest there and start thinking about there, because one of the things I've certainly found is when I interviewed through, I was in a different era than you. I only interviewed at 8 places, but I would have been extremely happy and well-trained at 7 of them. And I think you want to go into it not looking for your perfect program, but your perfect program, like more than one programs, and how this might work. So I think that's my biggest advice, is go ahead and reach out, but also be thinking a little more broadly about what other opportunities lie in front of you.
And so I recognize that we're getting close to 5 o'clock, which was our cutoff for this meeting, but I do have a couple of other questions that I want to try and squeeze in. And so hopefully our panelists and our audience can stick with us for maybe 5 or so minutes longer, so we can try and just answer a couple more important questions before we exit. Adaira, can you talk about what students should be doing, similar to what Carrie was just saying about how to cultivate a rank list? I think that it's really important not to get so hung up on one particular program, but to think about what opportunities are out there from all of the programs that you apply to. But how should students go about finalizing that rank list when they do get to that point? Because we know this will pass. We will have an interview season. We will have a rank list. So how should students approach that?
Yeah, I think first with the mindset that multiple places could be a great fit for you. And you'll often get to this place where you might have 1 or 2 finalists and you're stressing out about which one is so great. Usually it's pretty obvious if one is clearly not going to be a great fit. If it's really tough to tell, then probably they're both going to be fine for you. I generally break it down into themes of what to look for when it comes to picking between those finalists, and sort of, you can use this throughout the entire list, but I think it's most important when you're looking at like the top 3 or top 5 programs, since most medical students will match within that higher part of their rank list. I would say the first thing that's important to me is, did the residency leadership seem supportive? And you'll get a lot of that from the residents when you meet with the residents, about how supportive they felt when it comes to, if they raise an issue to the residency leadership, do those issues get addressed? Do they feel like their voices are heard? Are they able to reach the residency leadership when they need to very easily? All of those things, it's actually quite important, because when you get there, you're going to rely very heavily on your residency leadership. So you want to make sure that this is a space, these are a group of people who you could really turn to very easily. I think also morale is incredibly important, and even so within a pandemic, it's going to be a little bit trickier potentially to weigh this, but making sure that the residents actually feel happy and engaged and well, from all sorts of ways of thinking about it, physically well, emotionally well, mentally, and making sure that there's just a high morale and people aren't burnt out all over the place. I think that's really, really important for you when it comes to looking at a program. So starting with supportive leadership and going straight to, are residents happy? Do they have a good morale? I think from there, thinking a little bit more about yourself and your career trajectory, you might want to look into the mentorship structure. Are you actually beyond just the residency leadership, but are you able to actually engage with the faculty who are in your department easily? Do they do projects with residents? Do they meet with residents often? Are you only seeing them on shift? Or can you actually easily schedule a 1-hour meeting with someone who might be a thought leader in a particular area of interest you have? So having that support structure outside of the leadership team, and making sure that you're going to have someone who's going to advance your career. It doesn't have to be in a way that's beyond just being a good clinician. You want a clinical mentor as well, but just having that support system will be very helpful for you. I think having access to A good curriculum is key as well, making sure that you're going to be learning and being taught both on shift and in the didactic structure is helpful. So are you getting lectures from people who are really content experts, or is it just mostly residents lecturing each other? Is actually a key, because that'll let you know, like, what is my mental growth going to be like or academic growth going to be like over the next 4 years when it comes to just understanding my field from a bedside perspective. And I think the last important aspect is, what are the opportunities within the program, especially if you want to do academics, but even if you want to be a community doctor who just really understands community medicine, are there opportunities for you to dive deep into that? Meaning you can find clinical mentors, you can do projects within clinical medicine or community medicine. Just being able to have opportunities to build your CV, build your portfolio, learning how to lead a project and complete a project. All that stuff I think is very important. How you actually rank how you weigh that list that I just gave you is up to you, but I think all 5 of those are very important.
Okay. And so, Carrie, just as one more question for you before we wrap up. You mentioned that you're the DIO, or Designated Institutional Officer, for Beth Israel Deaconess Medical Center. And so you are over a number of programs. BI has everything from I believe it's a new ENT residency that's going to be starting. We have a new neurosurgery program that's going to be starting, or that's accepting residents. So there are a lot of students who are in this space where they were finishing up their 3rd years and they had planned to do their advanced elective in a subspecialty that they were now considering for residency. And they were also hoping to do an away rotation in that same subspecialty. Or they're coming from an institution that doesn't have ophthalmology or ENT, or doesn't have neurosurgery, or even emergency medicine. And so they're now in a position where not only do they not have a rotation from their home institution, but they also don't have an away rotation. And so how can students be sure to show that they are genuinely interested in a program and interested in that subspecialty, yet still be in a position to apply successfully, knowing that they don't have what many times would be considered essential pieces to the application?
Right. No, I think it's a great question. And I think that comes back to the very first thing we said on the webinars. Remember, you're not the only one in that boat. Everybody looks like that. And so for the tough, very competitive specialties, I think the wisdom of it for me is do what you can, not what you can't. There's going to be certain stuff you just can't do. And there's a bit that's happening in those fields. A quick warning about that, where the visiting clerkships are canceled, but people are starting to wonder about sort of backdoor deals where they could kind of sneak in and rotate in the back, and they're getting some offers from schools with that, and it gets very confusing. I would recommend strongly just stay with what the official line is, and if they're not having students, then kind of wait and know you're not going to be disadvantaged in that. When it opens up, grab the chance. In the meantime, at home, you got to do a couple of things. I would talk with your med school, whoever your advisor is, whoever your sort of core person is, and figure out, is there at least within your city a way you could work with even somebody who's in more of a community practice or private practice to actually get some actual clinical experience, so you can know, yes, I like going into the office and looking at people's eyes every day, or I don't. You have to figure that out. At the same time, help them make a connection with an academic program, because you're going to need advisors. You're going to need somebody who knows that field, looking at your application, saying, here's where you'd fit. And then think about, is there potentially, if it is looking like a fit, even a remote research project you could be a part of with some data entry or some case report or something, where you could start to get some experience and get some academic advising plus some real-time experience, so you're making your choice. And just know that everybody else is going to need to do those same couple of things. And I know that my specialty programs are particularly ready to offer that support to students, particularly ones that don't have home programs.
Perfect. And so I would just want to wrap up and just have each of our panelists to just offer just a piece of advice, either something that we've already said or something that we may have missed, But is there any other important information that our students need to hear going into this cycle? And we'll start with you, Rachel, and have you try and address that first. Any piece of advice or any questions that you think we haven't covered?
No, I'm not sure that there's anything that I'm sure there's lots of things we haven't covered, but off the top of my head, I want to say again that I think we as programs are in this together with you as students, and we're all feeling uncertainty, but in the end, we want robust, diverse, exceptional programs, and we want to recruit smart, diverse, exceptional students for the future of our training programs and to take care of patients in our institutions and communities. And so to just reiterate that the goal here is common, and not to think that everything is through a lens of people will have a disadvantage, or there are worries around this year being different than years past. This year is going to be different for our program directors and programs as well, and we're gonna figure it out together because the goal is common. I also think, as others have reiterated several times on the webinar today, reaching out to programs, as long as you do it in a respectful way, around questions, concerns, applications, that's all really okay. And recognize that right now we are also deeply involved clinically in pandemic response in all of our hospitals and our residency programs, and we will get back to you, but that getting back to you may have a delay because of what else is happening, but just be flexible with us through this process, and we will be flexible with you, and it will all work out on the other side.
Adaira, any parting words that you have for those still with us on the panel?
I definitely want to normalize everyone's stress and anxiety. This is definitely an unusual experience, I think, for all of us. But this is such a great time to also enter medicine and to really see what we could all be pushed to do as doctors and how we can use our voices. So I hope that you all stay very motivated, because this is actually, I think all of us have sort of mentioned in different ways that we all feel honored to be part of this process, and both on the side of, at the bedside and in offices, speaking with mentees and helping guide you all through this. So I would say reach out to your mentors and make sure you are finding support, and that there's no need to go through this alone. It's very much a community experience for all of us.
Great. And lastly, I'll go to you, Carrie, but as we go to you with this question, just want to tell the students who are participating, we do have a poll that we want to collect just to get a little bit more information about you all and your feedback from this presentation. So you'll see that pop up and while Carrie is answering the last question. But Carrie, any final words or piece of advice for students?
No, and thank you, Alden. This has been terrific to get to share today. I think for me, the thing that stands out the most is authenticity. And I would really use this time to truly think about what you want, what you're interested in. At the same time, recognize that you're very early on a long journey. And if you haven't gotten that all figured out, be honest about that. And all of us expect that. So I think that's what's important. I think one other thing that we didn't emphasize as much, but I actually think is really helpful, is do some searching on what some of the grads are doing in programs, and actually reach out and talk to graduates, because they can be an incredible resource. They're also, to be honest, the proof in the pudding for any program is, what do people who leave this program go on to do, and does it match maybe what my aspirations and dreams are for my career? So that's the other sort of piece I would leave you with. Reach out for support as you need it, and we look forward to seeing you in our hospitals, even if it's over Zoom. So thank you.
Great. And so I just want to give you all who are with us a little bit of a heads up on how we're going to approach this going forward. As Dr. Reed mentioned at the beginning, this is going to be a series of discussions that we're going to move forward with to really make sure that you all have access to information about our programs, and also that we're working to keep you all up to date on what's coming from the application process through the AAMC, NRMP, and so on. And so with that, we will take the questions that we didn't get a chance to answer and try and incorporate those into future webinars. We are going to start doing specialty specific webinars, and our first webinar is going to be on emergency medicine on May 12th at noon. We're going to talk about the nuances of applying to emergency medicine residencies, and we're going to have representatives from both of the Harvard affiliated emergency medicine programs here in Boston. If you are someone who's familiar with the work of our office, we do typically host our residency showcase, which is usually the second Saturday of September. We still plan on hosting our residency showcase on September 12th. We don't know if it's going to be an in-person meeting or a virtual meeting, but we do plan on having that space available for you all to learn more about our programs, ask more specific questions about our different residency opportunities, meet with residents and faculty just prior to the application process. So yes, we still will have our residency showcase. Please keep an eye on that, and more information to come. Additionally, more information will come about our other specialty specific webinars that we'll host. Again, thank you to Dr. Landry, Dr. Stark, and Dr. Tibbles for joining us today and sharing your insights. I want to say thank you to Fari and to Mostafa for helping us pull off another amazing webinar. Thank you for Dr. Reed for continuing to share your vision and the work that you did in establishing the visiting clerkship program. And even though rotations are suspended right now, we do hope to have students back on campus, because this is going to be our 30th anniversary of the visiting clerkship program. And we are proud to offer this content in lieu of opportunities for students to rotate with us. Again, thank you for joining us, and have a good day.